Hey guys, Andrew Dowling here, Mitch Kurtz, and thanks for joining us for another episode of the Altmed podcast. Make sure to hit like and subscribe to stay up to date with all that we have coming. All things Altmed? Yeah, that too. Okay.
Hey guys, welcome back for another episode of the Altmed podcast. Andrew Dowling here, with me as always, my co-host Mitch Kurtz. How you doing, Mitch?
G'day. Well, thank you.
You're looking fresh. And very excited to have our guest on today. It is Lauren Williams, who is a registered nurse. She specializes in medical cannabis and has spent a lot of time working with chronic diseases. She's currently working with our mate, Dr. Jamie Ricord at Ananda Clinics. Welcome to the show, Lauren.
Thank you. Thank you for having me.
Great to have you on. I know we've got a little bit to get through, but maybe, as we always do with our guests, if we could kick off just getting you to give us a bit of background about your journey to date as a nurse and how you kind of fell into working with medical cannabis.
Yeah, definitely. So I guess I went straight out of uni, straight into chronic disease management. So in my background, I even worked reception in general practice, and then I moved into nursing in general practice, did a lot of the chronic disease management side of things there, did a lot of district hospital in the home stuff as well, but that kind of tied in together with the chronic disease management. So yeah, I did a lot of the care planning and looking at the whole sort of picture as such. And then, yeah, I always had a bit of an interest in natural therapies. I was always quite interested in medicinal cannabis, have a bit of my own story as well with the history and chronic disease and using medicinal cannabis as such.
If I can jump in there, I'm totally at your discretion here, but can we hear your story? Because I love hearing people's stories with their own experiences.
Yeah. So, mine's endometriosis. I think hopefully people should know what that is by now, but if not, very chronic, painful, reproductive sort of condition as such. Had it from a very young age. I used to have a box of medicines pretty much this big that I used to use sort of all the time. A lot of them came with their own side effects as well, and very much was affecting my quality of life. And I remember I went on a holiday to Canada and I had packed my box that I carried with everywhere, and took it over to Canada. And I went over there and I somehow sort of ended up in this situation where I met somebody who actually worked in a dispensary in Canada. And this was just after legalization. So, everything was just flowing and it was great. And I just walked into this dispensary and, my friend that I'd made, I discussed with him a bit of my stuff, and he just was like, have you tried CBD? Have you tried these nano-emulsions, these oils? Like, introduced me to different chemovars and different types of cannabis that can be used for different things. And I just walked in and this whole world just kind of opened up, and I sort of was like, what am I doing? What are we doing in Australia?
Yeah. What's the Australian government doing? Yeah, exactly.
Yeah, definitely. And sort of how much this would help my patients and all of the chronic systemic suffering that we see. And so, yeah, I kind of found myself in there and just, eyes open. And then I came back to Australia and I was like, right, like, I've got to help other people. It massively helped me. And I've got to, get my teeth into this and try to do some good. So I started sort of self-studying for 2 years while I was still working as a nurse. I found it really hard to find curriculum of even how to learn about cannabis medicine here in Australia. I just had to kind of dig myself and find some things. And and then I started sort of doing some networking and went to a few events and things, and I met some great people and finally got my feet into the industry. So yeah, and have been I was lucky to get straight into quite a few consults, like straight off the bat, and did that for about 1.5 years, and sort of now I am.
That's awesome. And you've got just now thinking about, I guess, still how relatively young our industry is. I mean, you would possibly be one of the more experienced nurses, having, been in the field for a few years now, working with it. I mean, talk to me maybe first, just because chronic disease is what you kind of first encountered. I'm sure, I mean, a lot of people have now heard stories about people who have been able to get relief through medical cannabis. But yeah, I'm just interested, just some of the stories that you observed what a kind of, I mean, is there a kind of sense with these people of helplessness? Like, I'm just never going to, is it just for them about trying to get to a stable quality of life, knowing that have they sort of given up on actually living a good quality of life? Like, how do you see that?
Yeah, I think that is a massive aspect of chronic disease, living with that thoughts and those feelings of, am I going to feel this way forever? Is this going to get better? That is a huge component of it. And then, the disease itself, you can have a diagnosis, but how that person suffers and how that diagnosis affects every different person is so different. And sometimes that is not a fix all with standard first line medications. Sometimes they don't cover it. And sometimes things aren't working and they get to that point where nothing's working anymore, and they just have that sense of hopelessness for sure. And that's why I do love that, medicinal cannabis is an option. I don't know if it should be a last option as such, but that's where we are at the moment. But yeah, I love that that's available and it's an extra tool, even if it's not, I like to manage expectations. We like to be realistic. And even if it's not, the one fix all of it, can we help those ailments of the disease itself? Because if we can eradicate them, maybe we can eradicate, 70% of the suffering. And for a lot of people, that is very, very good goal, or very, would be amazing to achieve.
Yeah, well, and I suppose as well, and this is a different part of seeing that, like we've talked about chronic disease, but there's also now more and more people who I think are coming to medical cannabis. They might not have lived with a condition for so long, but they're realizing that is available now. And, maybe it's just sleep disturbance or a bit of anxiety, that sort of thing. And getting people to actually, and they're cannabis users, a lot of them, and but they've used it recreationally, personally, that getting them to change their thinking to say, actually treat this as a medicine. What's that like? Do you see these types of patients?
Yeah, definitely. And I do like to work with, there's always sort of two sides of it. I mean, these people, and they have used cannabis for such a long time, and actually for a long part of that time, they have, been shamed for it, been stigmatized for it. They've had to hide it. They've not been able to have open conversations about that. And they've not been able to have open conversations about how cannabis has helped them. So I guess you do get sometimes a natural reluctance as such to take on advice and to be able to, and they sort of like, I smoke 4 grams a day of flower and that's what I want. And it's like, okay, like I understand that, but do you know this? There's so much more as a medical picture that we can break down, and balancing that endocannabinoid system, raising the awareness that we do have an endocannabinoid system in our bodies and creating that balance, that's the ultimate goal. And sometimes you will see that reluctance, and there will be some people, they have the right to advocate for their own treatment, don't get me wrong, but they also need to make informed decisions. So do you know that if you use an oil, 4 times a day, or you use this to bring up the baseline of your condition, use your flower for your peaks and spikes, manage this holistically, having those conversations are really important so that, people are actually making informed, educated decisions. And also opening up that channel for that conversation and making sure that they feel comfortable enough to do that. It can be a challenge, but I definitely think that it's worth it. And I think that it's our responsibility to help these people. Yeah.
So what does medical cannabis help with then in your experience? Do you have any good anecdotes or patient, obviously anonymized examples of the kinds of things that one might expect? Maybe for people who have never been to a consult, or maybe even for people who have had consults or have been recreational users, or a plethora of different scenarios where they haven't maybe maximized what's available for their condition.
Yeah, definitely. There's quite a few, there's endless really, but I guess two that kind of like would pop to mind as such. We would even have like a teenage young male teenager, he'd been using cannabis for quite some time. He'd been just smoking a lot, day after day after day. And his parents kind of were like, okay, we'll be doing it. Like, let's get you on board and let's get you medically. And then, his parents kind of called and they said, oh, something's wrong with him. And we said, oh, what's that? And he goes, well, now he's, using his oils, he's using his vaporizer, he's doing it like how he was taught. He's actually gone and he's got a job. You know, this poor guy has gone from not even wanting to get out of bed to now he's getting a job, he's contributing with society, you know, he's socializing with his friends, and that's the real goal as such. Is just really creating, you know, happy, well-balanced people. And then you get all the great, like, heartwarming children's stories. I love those. Like, we'll have like even like children that are quite on the spectrum and they're not sort of engaging in terms of like their school, they're not talking, and you'll get mums that'll call you and they'll say, like, they're crying and they'll say, oh, he's able to, you know, write some words down now, you know, he says his name, he's engaging, he's social. And then there's so many more kind of layers to that social aspect as well that will just help with that growth and development. So I love those stories. Lots of grandies, like being able to play with their grandies again, like grandparents being able to play with those. They're
it's
really
profound,
fun,
isn't it? Like it's
so
not to be underestimated how profound this is.
We heard about this, especially with, say, children on the spectrum. This very interesting kind of anecdote from a doctor talking about how you'd have children who weren't just responding to being asked questions, but actually now engaging in conversation themselves. And that might seem like a very small thing to some people, but massive when you're dealing with those types of patients and day to day.
Yeah, massively. Like being able to, you know, show more personality, you know, parents being able to reconnect with their children better because they're seeing more of their personalities and things like that. Like, don't get me wrong, again, we always have to say, you know, it's not the one size fits all for everybody. We don't want to be out there sort of like hugging its false hope and all that sort of stuff. But if we're seeing this now with the limited amount that we have, how much sort of opportunity is there if we actually were able to, you know, research and provide these parents with some good solid evidence so they can work with their doctors, so they can have that option to try without feeling scared about it, you know, at least being able to be informed and have that doctor supporting them through that. You know, if we can advance it there and actually have so many people working together, I think that we would even see better results.
Yeah, and I have to just jump in. It's controversial, and you know, I have to say, I find that the medical establishment has, I think, too strongly spoken down, you know, to medical cannabis. I mean, you know, we get fixated, or the medical establishment gets fixated on, you know, is it approved or is it unapproved? And then all these medical cannabis products are unapproved. Well, you know, one only needs to go back in the last 100 years or so and look at all of the, you know, class actions and other actions that were taken against pharmaceutical manufacturers. They were all quote unquote approved products, right? Like, just because it gets a tick from a particular regulatory authority, it doesn't really mean that it doesn't have adverse events and all those sorts of things. So I don't know, for me, cannabis has got a very low risk and harm profile.
Especially CBD as well. Like CBD on its own, like an isolate, what is it? You can drink the whole bottle and you probably just get diarrhea.
Yeah, exactly. And well, it depends on the carrier oil, right? Like,
yeah, exactly.
Yeah, don't do that.
So just curiously, I think off the back of that, there's something I actually wanted to ask you is about, you know, you read about this a little bit on, say, Reddit or, you know, some of the other forums, let's say. But there's a lot of people that don't fully understand the nuance between the nurse and doctor element of the consults. And sometimes, you know, depending on which clinic you go to, you might speak to a doctor, and other ones you might speak to a nurse. And sometimes I think there's a lot of confusion around the collaboration between the nurse and doctor relationship. Are you able to shed any light on that, especially, you know, with the rise of, let's say, telehealth clinics where people aren't actually having that consult face to face? What that relationship looks like and how that works from the patient's perspective?
Yeah. I think there's always sort of a different relationship with a nurse to a doctor. That's always going to be present. But I think just sort of like outlining the positives of the nurses, you know, those nurses, they are the people that have sat by the bedsides once the doctor's gone and left. And they're the person who's, you know, supported that patient while they're in that bed. They've learned about, you know, the aspects of how their condition affects them. They've learned about their families. They've learned about their lifestyles. They've learned about their jobs, how that chronic condition adversely affects them, and they kind of understand that. And I think they're able to apply that sort of extra level of empathy and understanding with the patient, and just giving that patient a safe space as well. A lot of these patients, by the time they get to us, they're at their last line. This is their last hope. And being able to talk about that and get a lot of that off their chest, educate them. That's a massive thing. Educate them around how to have conversations with their family about them using medicinal cannabis, helping to undo a lot of that shame that they probably might be feeling for accessing it, because we've endured 100 years of that. That's kind of where that nurse can come in really important, just providing that extra support, and also just really understanding as a whole picture how it's affecting them. And then you target your treatment sort of based on that. What are the symptoms? How are you suffering? Sort of, and we just have that little bit of extra time to give that bit of guidance and give that sort of listening ear as such. And I think it's a really important part, because, doctors are really busy, and the way that the medical system is, in terms of all the funding, all that sort of the finances and stuff, it's quite hard. Doctors got 20 years of study usually, and uni fees that they need to make up for, and sometimes they don't have the time. They've got so many patients. So having that nurse doctor duo, sometimes you can just provide that extra level of real person-centered care, and that's why I really like that. We can all work together to achieve that.
Interesting. I also, speaking of what you just said at the end there, personal care, what does that actually mean? Because I mean, we know that people have different genetic makeups. Is it really tailoring to that, or is it tailoring to, or is it also the fact that medical cannabis itself can be quite different at the same time as people are different? So is the medicine. Whereas usually in traditional medicine, let's say for ease of example, paracetamol, you're only really dealing with one compound there. And although some people may have slightly different effects, you can always count on the input being the same. Whereas in cannabis, you've got, I don't know, hundreds and hundreds of chemicals, whether that's cannabinoids, terpenes.
It's like one complex biological system meeting another.
Yeah. Well said. So how does that actually translate to personalized care in the clinical sense?
Yeah, definitely. I think once you understand the condition in terms of, because one person who would have, say epilepsy compared to somebody who has very chronic pain, they're going to experience things quite differently. And understanding those symptoms, how they're experiencing those symptoms, and then the tailoring, it's understanding the medicine, oils, long acting, flower, 2 to 4 hours, those peaks, those spikes, understanding chronic symptoms, acute symptoms, like sitting and listening and figuring that out is sort of number one in terms of trying to figure out how they're suffering and applying that to the medicine. And then once you kind of have been doing it quite a while, you start to see patterns of specific strains or specific oils or dosing that sort of works similar for, I guess, interchangeable symptoms. And you can make recommendations based on that once you start. And also once you study that terpene profile and you really break it down as well, and you familiarize with yourself with the terpenes, being able to educate, this is what we're trying to do. This is based on what we've got. This is what we're trying to do. And then also, the great thing about cannabis, if that doesn't work, if you don't fit that box that we usually see, we do have options C and D to try. Don't get me wrong, medicinal cannabis doesn't work for everybody, but at least we've got options, and understanding the different compounds, understanding the different methods of administration as a practitioner, and then being able to relate that to the overall symptoms that person's experiencing. I think that's sort of that triangle that needs to be completed. Does that sort of make sense in terms of overall?
Totally. I've got a question actually for you about, just given the broad range of patients that you see, it got me thinking that we still have stigma, and people my age generally that I would know who have gone and been prescribed medical cannabis are almost like proud of it, like they get social status and say, I've got my CBD oil, I've got my flower or something. But I imagine there's a whole cohort of people who, from maybe an older generation, a little bit more conservative in their background. And cannabis is helping them potentially, but they're a little bit almost like embarrassed or ashamed. Is that a thing that you? Yeah,
definitely. And working through that with them is a big part of our job. They do have a lot of misconceptions and things that have been sort of passed down through, I guess, prohibition, and just it's so taboo to even talk about it, and to be able to have those conversations, and being able to educate them on dosing. Now it's medical, we can dose, we can use really small doses. You're using a drop of a 10 milligram, you're having 0.5 of a milligram. It's like if you have one glass of wine, or it's going to affect you a lot differently to having a whole 20 bottles of wine. So trying to kind of explain it in that way, we can control the dosing, and it's a lot different to what you've heard about people just going and smoking and not following the guidelines and just doing it because, and don't get me wrong, those people, they've probably done that because we haven't been able to see this medical model before. And that's what's really exciting about it, is we now have the opportunity to dose medically and use medically. And it's so important for us to focus on that and to utilize the research and the things that we do have to get cannabis recognized as a medicine. If we're going to use it as a medicine, we need to treat it like one, and we need to talk about it like it is one. And that's how we're going to undo those 90 years of what we've just kind of, now we need to kind of shift.
I couldn't agree more. And I just find it truly incomprehensible almost that where we are right now, there are definitely people out there who, even when they've gone to their doctor and their doctor is, say, an authorized prescriber or something, and says, hey, you actually might benefit from trying a CBD oil, and they're just like, no, I don't touch cannabis. I'm not even if you're telling me it's a medicine or something, like I am ideologically opposed to that plant. I will not take it. Like that, there are people out there. I've from some doctors that I've spoken to, but it's just, that's the extent of the stigma. It's crazy. It's preventing people from actually like potentially finding something that may help them. But
and I think there's also even, and when I first started this industry, because I'm like so passionate, so fiery, it kind of gets me in trouble sometimes, but like that was something I sort of struggled with when I first started, is experiencing that shame and that stigma. But as I've kind of gone on and I've had more of those conversations, it's actually kind of nice to almost drop that back for a second and actually understand a lot of these people who have those really strong concepts. Not only is it shame and stigma, some people have their personal experiences and things like that. They had a parent who misused or overused, and then they suffered from that as such. And then again, education, we have oils that are tested, they are regulated, we know how much we're dosing, we can use them in small amounts, we can buffer psychoactivity with CBD, like those sort of things. And being able to just have those conversations without it can be challenging if you are really passionate about something, but I feel like those conversations need to be had, and providing a safe space to be able to like talk with people through that. That's something I've kind of started to work on myself, like with friends and things like that. It's just kind of understanding where they're coming from, but then also providing them with the education so that they can actually make, again, and like an informed sort of judgment on it.
Yeah, absolutely.
Yeah.
You've got a question, Mitch?
Well, yeah, I was just going to ask, I mean, in terms of, making decisions from a clinician's perspective, and that would obviously filter down to, as a nurse trying to provide direction to a patient. Yeah. How important is clinical evidence in what you do like, there's obviously arguably quite a lack of clinical evidence from the TGA perspective in terms of listing these products as an ARTG listed product, let's say. But there's enough anecdotal evidence to, fill several
30,000 or something. Someone threw out the other day, 30,000 papers or something. And other medicines usually have got 5 or 10,000 or something like that.
And there's heaps of like people just down the street yelling things across the road that say cannabis is great as well. But there's there's just
actually just on that, I just have to give a bit of a plug actually to the TGA. They've put up these portals which have just, basically a visual data dashboard of all of the SAS A, SAS B, and authorized prescriber data and numbers, and it is just, you can just see the trajectory. I mean, Australia has very, very much embraced medical cannabis. So we're kind of getting to a point now where it's like, if you're ignoring anecdotal evidence from a group of people that big,
it's exhausting.
Yeah, well, we had a guest, Bonnie Goldstein, on, who's a very famous doctor from the US, and she talks about how she looks at the emerging clinical literature, and then she starts testing kind of with patients, maybe giving them not just CBD, but maybe CBDV or THCA or CBG in different ratios based on the literature that she reads.
Yeah.
I'm just curious where we're at in Australia with clinical literature and the approach, that you've seen within the clinics.
I guess we try to aim to look at it as much as possible. It's definitely, and we always will try to prescribe based on clinical evidence. But when you've kind of, like last year, I would do 70, 80 consults a week. And I kind of got to the point where it's like, but don't get me wrong, isolating the minors and that different level of complexity, I think we need to get there. I think that's definitely an aim. For myself, I would love to be able to do that. But at the moment, we don't even have those products. So it's not even, that's not even an option. We don't really have isolated minors. I think one maybe is about to be brought out. But you've kind of, at the moment, we're kind of sticking in that isolate, broad, full sort of. But if you understand the pathophysiology of the condition and you understand the endocannabinoid system, that's where you use that clinical evidence, because you know that, say, CBD is working on the TRBP1 receptors, which is your inflammatory receptors. So when you think of an inflammatory condition, you relate it back to that clinical literature that we have of the specific type that's working on what part of the body. So I guess that's how I practice as such. In terms of, and like I said, I work with doctors. So Dr. Jamie, he's very on top of all of the clinical literature. So if there's ever something that's like a gray area, I know that he's got it covered.
Yeah.
In terms of the prescribing, because I'm not.
He's a machine.
Yeah, he is. So I know that he's all over that in terms of the research and everything. But I would like it to be more accessible, because there's actually probably something that I've almost struggled with in the past, is finding that evidence. You almost have to sift through so much of it, and it's kind of like, where am I finding it? And then you're so busy with like so many patients and everything as well. You kind of, that would be really, really awesome to see a lot of people stepping up and making those more readily available for clinicians to be able to use. Like, we do use them, but we use them on base knowledge. But yeah, if we can start proving isolating minors and treating conditions based on that, that's just going to add a whole nother level.
Definitely. Okay, that's interesting to know.
Tricky though. I think, the clinical evidence stuff is a bit tricky.
Yeah, no, that's why I think it was in Canada maybe 5 years ago, they did a study of something like, they combined the research findings, like a meta-analysis of something like 10,000 research papers, and sort of weighted them in terms of, I guess, what was the trial, what was the procedure that was used in that trial? Was it the gold standard, double-blind randomized control, or was it, just an anecdotal qualitative evidence gathering? But in any case, they were able to kind of having that broader, let's look at all the evidence, through a single lens and see what actually are themes that emerge from that. I think, and that was actually where, the first sort of fairly solid finding that CBD could actually help people with pain. I know that won't be, a news to a lot of people, but yeah, something like that is we're probably overdue for another one, because there has been a proliferation of research, particularly.
I think it's hard because everybody responds differently as well. I think that's what makes it quite complex. So it's sort of like, it's great to have something on paper, don't get me wrong, like just proving what we know. But the thing is, so many people respond so differently to so many different things, and it's sort of just working along, going on that journey and finding that journey. This is what we start with, because this is what we know. And again, once you know that ECS and you know the symptoms, you just follow that and you use that to guide you. It's just understanding the ECS, understanding the pathophys of it, and then yes, you've got the clinical evidence there to like back it up. But then again, that makes it hard because everyone responds so differently, and then you have to trial, different, and then the product consistency as well. That's a whole nother hurdle of things that we look at. We can, we need those quality products. We need them to be like top notch, and that's where it kind of becomes tricky to take it off paper.
Yeah, like upstream for a producer's side, you need stabilized genetics so that you're getting consistent batches and, you know, be it for just dried flower or be it for manufacturing. So yeah, you're absolutely right. Like consistency is the key, but I don't expect to be able to do a huge deep dive on this, but I'm just kind of interested when we talk about the ECS and the the ECS cannabinoid receptors, CB1, CB2. And I think you mentioned just sort of in passing the relationship between understanding that coupled with the pathophysiology of a person's given medical condition. Maybe give me an example of like where you can, once somebody is properly diagnosed, you can sort of realize, well, we're going to be working with, say, these receptors in this part of the body to stimulate, you know, that process of trying to bring that person into balance. Is that kind of your approach to it, or is that more in Jamie's wheelhouse? Like, what's your...
Yeah. Jamie is so great to learn off in terms of the way that he looks at things. Because I've sort of gone from one type to Jamie's type, and then Jamie's type just kind of wraps it all up with a nice little ribbon bow because he really has that understanding. But in general, you know that some things respond better to others. So you generally will know that, you know, working on the CBD and the anti-inflammatories, or the regulation and creating that regulation through regulating that anandamide if you've got chronic consistent symptoms. So asking questions like, when you can't sleep at night, is it because you've got racing thoughts, or is it because, you know, you're having like an acute panic attack, like things like that? And then you kind of, after a while, you're sort of like, okay, well, what generally calms the racing thoughts side of things? And you're like, generally that's more the CBD, because we're working on that consistent level of that stabilization of that anandamide. And then that is kind of creating almost like a consistent behavior, because if you're used to going to bed at night and you're always, you know, got that really active brain and you're always really thinking, if we can create regulation, those patterns become less prominent, and then we can see changes overall. I know that doesn't really relate with
No, it does. It's like it's
things, but
your like physiological state is not heightened. It's not stressed. You're not breathing heavily. You're calm, and it all folds into, you know, at least being able to end the day really in a good tranquil state to be able to just nod off nice and easily. So no, that completely makes sense to me.
Yeah, and I guess that's the thing with the ECS. We're still learning that as well, because we know about anandamide. We know that there's 2AG there, but sort of working on, and this is where Jamie's, again, like really on top of that research side of things, is working on what's working on the 2AG. How are we doing that? Are we directly stimulating those C1s, those C2s? How are we working on that? So the more evidence and the more research that we have in terms of that, that's where we're going to be able to really see the difference. And hopefully a lot of companies are starting to work more on that and focusing on, really specific conditions and specific pathways. And that's where we kind of need to dive in, because we know the basics in terms of regulating the anandamide and that working on nervous system and inflammation. And then, we know that THC directly stimulates them. So then you've got to take the patient. You've got to take the patient. How are they suffering? Do they need regulation? Do they need do they need the direct stimulation? And sometimes you don't work that out until a bit of trial, first line, second line, third line. And that's why there's a lot of people, you know, they'll go for their medical cannabis consult and say they've got anxiety. And then straight away, here's 4 grams a day of flower. And it's like, well, what are we doing there? What are we even trying to follow there? That's not good medical prescribing. You know, we need to regulate. We need to, what are your symptoms? How does it exacerbate for you? How can we regulate that? And then if we don't create regulation, do we then need to directly stimulate as such? So that's kind of how, you can kind of, you gauge that after a while, but you have to, every patient again is so different and how they experience things. So
When I hear you say that, when you say, okay, patient comes in with anxiety and leaves with a bunch of THC flower, it sounds you know, akin to this kind of, I don't want to say not very well talked about. It is talked about, but this underlying thought that there is this recreational market kind of moving into the medical market, and it's maybe akin to the California situation where you had people figuring out what to say in order to get their script. I don't think anxiety is the right one if you want flower, but in saying that,
I don't know. Some companies don't
sounds
mind.
right. But how do you manage that from a nurse perspective at a clinic? Like, do you see the recreational market come in? Do you hear about people, coming from the black market? How do you feel about that as a nurse? How do the doctors feel about that? Is it a problem, or are they kind of happier even if they're not maybe a genuine patient? You probably can't answer that, but like to move them into something that's a bit more at least they know what they're getting kind of thing. Or I'm just curious how that sits in from the clinic side.
Yeah, no, it's definitely difficult. It's probably one of the most difficult things that you can face as a nurse. Again, there is a few layers to it in terms of they've been using it for a while. They know that it helps them. But if you're coming to a medical source and you're coming from medical recommendations and you have sort of complete refusal as such to follow them, where's our duty of care then to make sure that we are giving good clinical care? And that's the thing, we in 10 years time, if the TGA come and they say, well, we gave you all these studies and we said, CBD is generally a first line for anxiety, use your flower for the breakthrough. But what we've gone and done is we've gone and given everyone 4 grams a day of flower and just gone straight with that. What's that going to do for cannabis getting recognized as a medicine in the future? And who are the people that are going to suffer for that? And I think that patients who may be recreational using the medical place to access their cannabis, thinking about if they love this plant and we love this plant and what we're going to do for it, why we need to work with the TGA and we need to work with our recommendations and with our research, and so that we can get recognized as a medicine. That's sort of because the people that are going to suffer for it are, again, kids with epilepsy and those cancer patients, those chronic pain patients. And I understand that some people, maybe if they're using it recreationally, but they've got some sort of like underlying something that they're also treating with it, that's okay. We can help you with that and we can have that conversation. But when you endure like the abusive side of that patient, when you're as a nurse got a medical obligation to educate and prescribe properly and follow what we should be doing, that gets frustrating for sure. And it can get quite tedious because it's just like we're here as medical professionals. We want to help all these chronically very sick people. If you are wanting to use cannabis recreationally, there's plenty of other channels for that. We don't need to convolute all of our data. We don't need to convolute all our prescribing. But then again, I think that's our responsibility as clinicians and as companies to do the right thing and to have that really decent screening process and have those standards and those education of, no, this is medical. This is microdosing. This is how we do it. We use oils and flower. And if the patient doesn't want to take the medical advice, where do you go from there?
And I think that's if you don't mind, I'm going to go devil's advocate for a second, Lauren, because I agree generally with that. I suppose my only comment would be, and I agree definitely with the point that recreational user that's accessing the medical model just to get flower dilutes the data and the worth of the medical model. Totally agree with that. But at the same time, the quality, which is a total question mark in terms of both cultivar, potency of active cannabinoids, they're not going to necessarily know that from what they access in the black market. So in a way, whilst I'm not advocating for it, I definitely think it's at least people can better understand what they're having. It's almost like, the difference between moonshine and actual alcohol, and people being able to read a label and find out what it is that they're actually drinking. So I suppose that's the other side of it as well, is just, patients being able to know what they're taking. But yeah, certainly you hear about practices of, all sorts of irresponsible, types of behavior that go on. And it's actually on both sides. So, there's the patients that doctor shop in order to get as much cannabis as they can. And then there's, very liberal prescribers that seem to not bat an eyelid at prescribing someone, 4 and above grams a day, you know. So yeah, I think that we need to rein that in. That those sorts of
100%.
practices need to be reined in for sure.
100%. It is, because again, if it's a medicine, we need to treat it like one. And
Mm.
I do think that I don't think that anybody should be ingesting any substances that they sort of don't know where they come from as such. But at the same time, is that worth convoluting a potential plant that could be medicinally very helpful for a lot of people?
Yeah.
But it's not linear either. It's really not. Like recreational, medical, if there's something underlying, that's not being sort of helped, that it is helping with, I think there is. But I think that's where it comes down to us and just being like, yeah, well, we don't have a recreational market. That's at the end of the day,
Yeah.
we don't have a recreational market. We have a medicinal market. And that's what we're doing. And that's what we are supposed to be doing.
Yeah.
And if we want to be going for recreational cannabis, that's somebody else's. That's like a whole different thing. I just am like sort of like blinkers on. Like we have bigger things. We have a lot of sick people that we need to help. And I'm sorry that like that is something that, you know,
And then
that
there's also there's something
with,
in between, right? Like there's there's medical, there's rec, and then there's kind of well-being in between, which is, you know, I was
radical.
My twin brother lives in France. I was visiting him earlier this year, and he we was just pointing out everywhere we went, you know, it's so easy to access CBD oils in Europe, and they're all really positioned in that way where it's you know, next to your supplement.
Yeah. And I wish that was the case here. I really wish it was. But unfortunately, the people that are trying to do the right thing here are getting sort of over suffocated by some that maybe are not. And it's
I'm going to say not even maybe are not. They're just not.
like, and then there's the people that are trying to do the right thing. And then if again, are we going to undo the work that we've done? Because I don't want to walk down the street in 5 years' time or a couple of years' time and someone say, oh, I work in medicinal cannabis, and they say, oh, is that where you can just call up and get whatever bud you want? Like, because that just undoes all of the good work that we've done and all of the good work we see. And that's systemically, again, if somebody hears that and they see that, someone who's considering medicinal cannabis and is now sees it as a channel that you just use to go get whatever you want.
But this is what's happened. This happened. We talked with Bonnie Goldstein about, I can't remember, proposal something, I can't remember the number, but that was the Californian law that when passed in 1996 really opened up this idea of, you know, once you get a green card, you are good to go. And so I feel just inevitably what
Proposition
has happened.
64?
Yeah, something like that. And they, you know, the rec market moves in, and it's the deluge begins, it's difficult to rein it in necessarily. But I think there will always be, you know, a medical market where you have clinical trials being done and people really focusing on just trying to, you know, pioneer medical treatments with this.
There still is in America, and there still is in Canada, a medical market. I mean, I'm in two minds about this, because I absolutely agree with you about that medical side of things. But at the same time, I mean, I would personally be in favor of legalizing cannabis, generally speaking. So like, in a way, it's almost like a stepping stone to getting there, I think, or at least it was in California, let's say, and I feel like it could be the same thing here. But so you've got, on the one hand, absolutely, the medical model it should be respected for what it is and not used in a way which it shouldn't. But at the same time, if it kind of helps us get to that next stage where there is both a legal market and a medical market that live in harmony, then I'm kind of for that at the same time.
So. No, I agree. I do think like that people should have that access, and they should have the access to the quality products, definitely. But yeah, it just makes it hard when there's people that are really trying to do the right thing for the medical side.
Absolutely.
There's some people that aren't. It just becomes a little bit too unclear, and it just undoes a lot for when the rec gets involved in the medical side. I guess it's all one big picture as such, but you know what I mean? I just really want to focus on making sure that people see medicinal cannabis as medicinal. Like, I just think that that's so important, because we need people to understand, like, someone goes, can cannabis help with pain? Like, that's where people still are thinking. Like, we're very blessed because we work in this industry and, you know, we've seen it firsthand. But you can go and speak to anyone and they'll just say, oh, does medicinal cannabis, you know, help with anxiety? Like, they just generally have no idea. And then I just don't want them thinking, oh, medicinal cannabis is just smoking weed and getting high. I just really don't want the potential people that it could really help thinking that. And I just
that's
really
especially
hope
hard
that we can
though
avoid
on the
that.
Gold Coast. I mean, where you are, it's just people love cannabis up there. So we just got to call that.
Yeah, people would really like it, but yeah, I guess.
Shout out to all our listeners on the Gold Coast.
They can't hear you; they're too stoned. Speaking of which, people not really understanding that it even helps with the most basic of things, like, as pain. If you're in the cannabis industry and you understand that, it might be good to kind of just finish off talking about a few of the niches that maybe people aren't aware that cannabis helps with beyond your top three, which is, you know, pain, anxiety, and sleep. I did note that you spoke briefly about endometriosis, female reproductive health, that kind of thing. Is there any insights you can share on that particular enclave?
I ideally would love to see a vision where we do have, like, specialists who can, that triangle we were speaking about before, you know, really understanding the different types, the different methods of administration, the pathophys of a specific condition, and the complexities of it, because a lot of these conditions are quite complex. Having, like, a one person or, like, multiple people, specialists that you can go to who actually incorporate cannabis into that. Like, I would love to see that, like, having almost like a specialist cannabis person for everything, if that makes sense. And then
you mean a doctor?
Yeah, but like specializing, because at the moment we've got a lot of doctors that are sort of like, oh, like, we're lucky to have a few, but they're generally, like, you know, general practices or something. Like, have we ever met an orthopedic surgeon who specializes in cannabis, who can prescribe post-operative cannabis? You know, do we have a gynecologist who specializes in endometriosis and really knows how to prescribe cannabis? Like, seeing more of that more often, I think will have, because again, those patients who have tried a lot of things and are at wit's end, they usually end up with a specialist. So being able to see specialists trained in that and having almost like consultants as well, I think consultancy would be a really exciting sort of thing for the space as well. Even going out to companies and sort of educating them on how to, you know, have a really decent ethical company. Like, I think that's so important.
What is
like,
a decent ethical company? What does that look like?
Patient focused and, like, not so concerned about money, to be honest. Like, that's at the end of the day, like, I think, I think that money does complicate a lot of things, and
it sure does.
I think that if we get back to the basics in terms of what we're actually here for, and that's to help people and to help people in that pain and to educate, I think it just gets too messy with everything else.
I was thinking as you were describing that, like, imagine if every hospital, for example, I mean, you've done the rounds at hospitals, if there was just like a resident cannabis doctor, 100%. You know, come out of surgery, yeah, mate, all went well, we took out your appendix, here's a Mighty Medic, go for it. Like, it's
here's an oil. Here's an oil, Andrew. And maybe a Mighty Medic if you've got breakthrough.
So you put the oil in the Mighty Medic, isn't that?
But no, there's a lot of patients, even, you know, sorry, we're probably over time, but there's a lot of patients who will get admitted to hospital and they will call us, and the doctors have had no idea how to write up their medicinal cannabis, and they've pumped them back on opioids, and they've just spent 5 years getting off those opioids, and now they're back on them heavily and they don't want to be on them. They're making them sick and things like that. Shout out to Deb Ranson, the nurse of my heart. She would always call the hospitals and have a good chat with them. And that's the thing. Like, we need people like that who advocate for that, so that we can see that change. And I think that unless we keep quiet.
I love it when medical professionals yell at other medical professionals. One of my favorite things.
Sometimes it needs to be done. But it's going to make it more mainstream, and just, again, working on that education. Hopefully we'll get there one day. Fingers crossed.
Yeah, well, that's a good optimistic note to wrap up on. And I could very much see you in that role, actually, just kind of the red.
Just going and yelling at people.
Going around, yeah, yelling at people and like just advising everyone on, no, this is what this person
It's
needs.
usually me on the weekends. Everyone's just like, oh my God, don't get it started. And I'm like, I'm sorry. Yeah,
Awesome.
because don't start, make someone stop.
Well, yeah, thank you so much. Great to grab your insights. Yeah, love the work that you and you're currently doing with Ananda. Yeah, I'm sure we'll cross paths at some point and maybe do another one of these at some point.
Love the passion.
Yeah.
Cool. Thank you.
All about that.
I appreciate it. Sometimes it's a bit much, but try to like keep it somewhat level.
That's right. Just as long as you're yelling at somebody else, I love the passion.
Yeah. Or if you yell nicely in like a controlled way. But no, it comes from the passion for sure. So
no, we're here for it. Well, yeah, until next time. We'll take care.
Okay, thanks guys.
Thanks,
Bye.
Bye.
Hey guys, Andrew Dowling here and Mitch Kurtz. Thanks for joining us for another episode of the Altmed podcast. Make sure to hit like and subscribe because we've got heaps more content coming out and it's really fun and great and we love it all. Also very good.